Hello and welcome to Doc Talk, the educational and informational conversation series. I'm your host, Jayashree, clinical nutritionist, and it gives me great pleasure in welcoming our guest for today, none other than Dr. Brian McGuckin, chiropractor and natural solutions expert. He has blended nutrition and lifestyle management into his chiropractic care and his practice, and is always on the lookout for the root causes of his patients' health issues, and it's directed to providing more effective solutions for lasting healing. So thank you, Dr. McGuckin, for joining us.
Oh, you're welcome. I'm glad to be here.
Absolutely. So, Dr. McGuckin, I'm going to start off with just asking you, what got you into chiropractic medicine in the first place?
When I was in high school, I had a lot of headaches and neck pain, and the only thing that worked was the chiropractic adjustments. I got tremendous relief. It was not long lasting. There was a need and a desire to want to come back, and I was stymied as to what was causing the headaches. So, and during chiropractor school, I was still waiting to find a better answer. And after chiropractor school, I was introduced to a group called the Chiropractic Internists, and Dr. Jaffe from the ELISA ACT allergy lab, lymphocyte response assay lab, he had contacted this group and introduced his allergy test. And then I found my answer. The reason why I had this chronic inflammation was delayed onset allergies.
So delayed onset allergies, that takes me to the fact that, the immune system is involved in a lot of our healing practices. So is that something that you do try to look at in, your patient healthcare?
Yes, we see a tremendous amount of just as in going in that direction, in the chiropractic direction, we'll see a tremendous amount of inflammation in the muscles. We'll see it in the discs with the scar tissue. The scar tissue becomes hypersensitized to the inflammatory load. And when we can do the delayed onset allergy test, we can actually reduce this inflammation. And when this inflammation is reduced, the muscles are relaxed, inflammation in the disc is reduced. Now people can hold what's called holding an adjustment. They're just simply pain-free, and they have the mobility that they want.
Right. So do you also do immediate allergies, or do you only look at the delayed onset ones?
We got frustrated with the immediate allergy testing. We would do the test, and we would test for let's say 96 items, whatever the lab would offer, and they would come back 0 for all of them. It was obvious from the symptoms of the person's conversation that we were having with the consultation that none of their responses were immediate. Their responses were obviously delayed because there was not an immediate reaction to the inflammation. So we will run them on request, but it was frustrating. But what we won't do is we will not do an immediate test alone, because we insist on the delayed with it so that they get answers.
So it's kind of like looking at the full spectrum.
Yeah, it just misses way too much, and patients aren't happy.
Yeah. And now, do you also? I'm thinking that since you're, you are a chiropractor, you're looking at immune sensitivity. Is that what sets you apart from other chiropractors, or is there, are there other things that you do that other chiropractors, or I don't know if you may call it like regular chiropractors, do?
Yes. Yeah, well, that's. I'm glad you brought that up. just this past week, we had somebody come in with severe muscle inflammation, and they get regular treatments, but the pain is intense, and it's debilitating, and he's looking for a better solution. So when I do the allergy test, we do a panel that covers 406 items. It's foods, chemicals, preservatives, molds, and toxic metals. I have no idea what's causing this fellow's inflammation. So we run the test. He had multiple food items, and he was allergic to the chemical toluene. Where we live, there's a tremendous amount of road traffic, and toluene is going to come off from the car exhaust.
Right.
Now, in addition to the allergy test, we do an omega-3/6 concentration test to find out the omega-3 oils because of cell permeability. We need the cell wall to let nutrients in and to allow the cellular debris and stored toxins to come out. So his omega-3 oils are low, his vitamin D was low. So now with this information, now we can put together a plan. We want to also identify his first morning's urine pH. This gives us an idea of his cell energy. We want it to be in the 6.5 to 7.5 range. His was like in the 6 range. So his pH isn't terrible, but he doesn't have the cell energy to repair. So now we can start to put this together. We will use the purified L-ascorbate vitamin C along with a bioflavonoid it amplifies the vitamin C. So we'll use quercetin.
Right.
And that will jumpstart the cell energy along with magnesium. Now, to get magnesium in the cells at the rate that's needed for cell repair, the intestines can't handle it. So there's a very unique way of getting the magnesium up into the intestines through the neutral pore, not the active pore. The active pore is typically what's going to absorb magnesium, but in higher dosages, it's not going to work. So we can mix the magnesium with the liquid B vitamin choline. Now that the neutral pore thinks the choline is a fat, and it'll suck in the magnesium that's attached to it. And now we can get vitamin C and magnesium in the cell at a high enough concentration to stimulate cell energy production. And we know we're doing this because the first morning's urine pH will change. So now the next part of our process is they're going to start detoxifying. So we're going to take the vitamin C to diarrhea, that's the vitamin C cleanse, the vitamin C flush. And what we're doing there is stimulating enough cell energy to increase lymphatic drainage, and lymphatic fluid will drain into the rectum via the mesenteric colon, and we will discharge the lymphatic fluid. And we know we're doing this. The first morning's urine pH will go up. And also, like in this particular person with the toluene, it'll smell like a chemical factory in the bathroom. We're migrating that much stuff out of them. And what we're hoping for is a reduction in inflammation as we progress.
So looking at the delayed sensitivities, picking out what's causing that burden on the immune system, I guess that's what you're trying to, that's kind of like the root cause, right? So you don't know what's causing the issue. So you're trying from, working from the get-go, from the ground up. So you're looking at what's affecting the immune system. You're looking at all the other type of nutritional burdens that the person must be having, or the absence of the right type of nutrients. So, and that's where the magnesium and the vitamin C comes in. So now with this C that you say, and this procedure, have you found that has any kind of negative aspect when you're talking to patients? Because you talked about the colon and you talked about vitamin C causing it, that the person's coming up to a certain level, and that kind of tells you how much C they need. So have you had any kind of pushback or any issues with having the patients do that?
Well, it's funny you say that. The number one comment we get back is, "Can I do it again?" And I know I know that sounds crazy, because
that's good, though.
we should be selling toilet paper by the case, but the number one comment we get back is, "I had so much energy. You told me to do it every 2 weeks. Can I? Is it okay if I do it next week?" And yes, you can. And so we've gone from telling people do it every 2 weeks to doing it once a week until you feel like you are not getting that surge of energy, and to the point where you don't need to do it anymore. But that's the number one comment we get back is, can we do it again? There are some people who may have a hemorrhoid issue where, and then there's more of a practical, it's not a negative, the patient's not negative, the patient just has a practical situation where we have to not be so exuberant on our efforts to do this. We have to just slow things down. But typically, most people are laughing or like bewildered that you're talking about all these things. But once they do it, the conversation is completely different. They're ecstatic, and when they're smelling chemicals in the bathroom, they just can't believe it.
I guess, like they say, seeing is believing. So when they're feeling better, they will do what it takes to feel better.
Yes,
and,
yes.
I guess that's what it is.
And the reason why I use this program, this process, I need results fast. So within 40 days, we're having a tremendous improvement, and people can, they are ecstatic, excited to continue. I can't think of any other program, a process of helping a patient through a process that gives this much improvement this fast.
Right. So we're looking at the immune system, and we're looking at these nutrients for detox, especially the vitamin C. So that brings me to the next aspect of when we talk about healing, we always talk about the importance of the gut. So would you also look at that when you're, discussing your healthcare practices with your patients?
Yeah, this particular person had over 20. We tested 406 items,
right?
And this person had well over 20 allergens. So that, in my opinion, that translates into a leaky gut. We have a permeability issue with that many allergens. So at this point, we will use glutamine with what's called PAC, and I don't have it in front of me to tell the exact description of the PAC, but it's a recycler it's a paradoxal alpha-ketoglutarate.
Right.
Now that recycles the glutamine, so we don't have an imbalance with the other amino acids, but that stores sugar in the intestines, so we can begin the process of repairing the intestines, so we don't have so many allergies, new allergies reproduce. Now we'll also use the probiotic Digestiguard to also help with reducing inflammation. The goal is, like in this particular person, we would with that many allergies, we're going to redo the allergy test in 10 months. And our goal is that they would be below 20 allergens, showing that we have improved and repaired their intestines. So it is part of this ongoing program, because we don't want to go backwards. We want to see success year in, year out progressively.
Right. So, I mean, with all of these aspects feeding in, it's obviously not a linear process. It's the whole body working as a, well-oiled machine, as we would call it. So you're taking care of every aspect of that. When you're looking at the nutrients, are there any specific nutrients that you would use more than others? Like, I know you mentioned the vitamin C, you mentioned, magnesium. What would be the top 5 or 6, nutrients that you would say, or something that you use, on a repetitive basis?
Well, keeping in with this, we'll keep in with this patient as our example.
Right.
This person does not have a rheumatoid arthritis, but in the rheumatoid patients, we would use a significantly large amount of B6 to protect the kidneys with detoxification. The rheumatoid antibody will actually be pushed through the kidneys, as we can actually get this to be discharged. If we can get rid of the rheumatoid antibody faster than the body can make it, we can get on top of reducing that inflammation. But the kidneys are going to take a lot of work, and we need the B6 to protect the kidneys. So everybody gets the LifeGuard multivitamin because of the antioxidant, real good vitamin E in it. But what we're after is a healthy amount of B6 in the natural forms so that it protects the kidneys. The other one is the omega-3 oils, because we need that cell permeability. We need that cell.
Right, you mentioned that. Yep.
And the problem we have with the omega-3 oils is we need something that is 100% free of mercury, lead, arsenic, cadmium, 100% free of PCBs, dioxins, and benzopyrene, and zero oxidization. So we need an oil that's packaged in nitrogen. That's and if you don't package it in nitrogen, it's going to oxidize. It's going to go rancid. Right. So we're very, very particular about the oil that we give people, because otherwise we're just going to add to their toxic burden, and then the person's not getting better. So the 5 or 6 items that we go through would be the Lifeguard, the vitamin C, quercetin, the vitamin D, the D3 cell guard, and the omega-3 oils, the EPA, DHA. Right. So that's where we start. Then from there, we would add in the magnesium and choline citrate, depending on the person's situation. Like in this situation, that's what we did. Now we will wait a little bit, just because it's overwhelming in pills. We will wait a little bit before we introduce the glutamine and the probiotic. And just to stage things, we'll give people the option, but if some people don't mind, and some people it's best to
I always feel they like doing things, in a stepwise fashion. If you load everything onto them at the same time, then they may not really want to do anything at all. So I guess you want to see some improvement every step of the way, right? So that's absolutely perfect. I mean, this is such a different way, and I think that's really answer to my question to you is, this is, I guess, what sets you apart from, like you said, a regular chiropractor, because you're not just doing the adjustments, not just the mechanical stuff, but you're looking at it from within. You're looking at the body from within.
It was the Health Studies Collegium that offers a lot of this training, and they focus on reducing inflammation and increasing cell energy, and they have the research, and that's where I've learned in the last several years. That's where I've gotten most of my knowledge, improving in knowledge, and improving on staying up on what's the latest. So that's been a great group, the Health Studies Collegium.
Right. So Dr. Jaffe and the Health Studies Collegium, we all put together what we call PIH Academy, which is now our CE, continuing education program that we're doing every year now for the last couple of years. So that's, thank you for being a part of that as well, and trying to get that information from there. What kind of folks do you see for the most part? I know a lot of people who work in this type of field will see the most difficult type of patients. Can you tell us a little bit about some experiences or some typical type of people that come to you?
Yeah, it's expanded into just a normal family practice, from the intestinal problems, the colitis, from all the colitis type of ulcerative colitis, all the big, I call them the bleeders, trying to get those poor people to get back into shape. All the way up to the cardiovascular conditions, where now we're seeing the cardiologists will report back that the patient's treadmills are improving. They're very excited, very happy. And then when I talk to colleagues about the cell energy, it's in repair and allowing the cells to breathe. Then we're talking to somebody about retinitis pigmentosus and optic neuritis. And so we're going from one spectrum all the way to the other. So we see our fibromyalgia type conditions with the musculoskeletal type things to the migraines, having a solution for a migraine. I'll say more of a permanent solution, in the sense that we can get on top of this, and the patient knows then what to avoid, so that they can minimize how many headaches they're going to have. They can control it. They have some control over their health, and all the way up to the more serious things with the cardiovascular and then the eyesight issues.
Right. So from the very simple to the very complex cases. All of that is something that you see, and you've been able to provide a solution for all kinds of issues there. That's
Oh,
amazing.
yes.
Yeah,
Yes,
that's
it's
amazing.
exciting. It's exciting
It's
in that regard.
exactly. So let me ask you about some lifestyle mechanisms that you use. So I know we talked about the immune system, you take care of that. You look at delayed allergy testing, looking at supplements, looking at the gut. Now we do, obviously there's a mind-body connection. So what do you think about that? Do you utilize any of that in your practice?
Well, we with a smile, we try to get everybody outside walking. But what we did incorporate was painting the walls green, and we
Nice.
did buy the Par 38 diachromatic lights, and we put those in the rooms where we would do our standard treatments here in this
Right.
office. And we found that we call it the green room, and the patients migrate. We have one room which is standard lighting, so I can see better, but the other room is green. And if the patients have their preference, they all go to the green room. And we notice that there is better therapy. They respond therapeutically better in the green room. So there is something to that. And we do encourage that people buy their own, to use the Epsom salts and baking soda baths as another way to relax themselves.
Right.
You get outside and walk to also de-stress. But from a clinician standpoint, the Par 38 light in the treatment room has been a success.
So tell me a little bit about this Par 38 light. So this is not a regular bulb, correct? It's not your regular light bulb that you use.
It's not a Christmas tree light. Yeah.
Right. So it's a specific Par 38, and it's available,
It was at the hardware store. They're the floodlights. And so we shopped around. We had to go to a couple of the big box stores to look for a lamp stand. And then we put in the floodlights in this lamp stand.
Right. So this is a light that's actually not a routine bulb, but it's more in the lighting kind of industry, a floodlight type of light, Par 38.
Yeah.
And it's and you would shine it about 5 to 6 feet from the person, right? Is that?
Yeah, we have the ceiling light, so I put one of the ceiling lights, and then we have two lamps. One's a big tall lamp, one's a small.
Nice.
So we have lights coming in from multiple directions, and the room itself. We did paint the wall, not an offensive green, a very nice green.
Forest green. Nice.
Yeah, we didn't do that. The paint store was good to me, but it worked. I was very impressed with how it worked.
That's amazing. It's amazing how little things can just tweak that whole effort a little bit more, and can get you onto a road to healing. So it's amazing what you've been doing, Dr. McGuckin. Extremely grateful for having this discussion and knowing a little bit more about how you deal with your patients. So I'd like to thank you for joining us today once more. And if folks want to know how to reach you, what would the best way be?
To email.
Okay, all right. And we will have, once this is recorded and put up, we will have your email there, right? For folks to get in touch with you. So thank you once again.
Oh, you're very welcome.